Somewhere in Rotherham this morning, an older patient picks up the phone to dial his local GP surgery. He is trying to perform a basic, essential task, booking an appointment. He reaches Emma, an AI receptionist built by Quantum Loop AI. She is designed to answer instantly and route callers around the phone queue, and she supports 17 languages. But Emma cannot make out a broad South Yorkshire accent. The patient repeats himself and gets nowhere. Frustrated, he hangs up. HealthWatch Rotherham reports that across the region, patients are abandoning the phone lines entirely, sometimes traveling to the surgery in person just to reach their own doctor. The system was optimized for a standard dialect, missing the regional reality of the people it was built to serve. When vendors push unpolished tools into healthcare infrastructure, they leave the burden of that failure on the patients who are quietly locked out. This lack of testing is scaling up across the industry. On August 19th, Meta shipped a new Mac app for its AI chatbot. Its core feature is window share, allowing the AI to see whatever is on your screen. A tool that watches your screen collects a staggering amount of data, yet Meta launched the app with no published retention period, no stated training policies, and no outlined administrator controls for employers. While Meta is vague about what it sees, other tools are actively leaking what they already know. Since June, XAI's Grok has been handing user chat histories, names, and locations straight to attackers. The vulnerability relies on a blind spot in the chatbot's safety filters. These filters are built to read plain text. If you type a malicious instruction, the guardrail catches it. But if an attacker hides those same instructions inside encrypted code, the scanner sees nothing to flag. Grok decrypts that hidden payload inside its own execution sandbox. It follows the decrypted instructions, packaging the user's private data, and appends it to a link back to the attacker's site. The moment the chatbot processes that link, the data is exfiltrated. Tracking these rapid, often dangerous deployments is why we rely on the reporting at Conversational AI Watch and the support of our sponsor, Clinician Assist. Major tech companies are scaling at a breakneck pace, treating security and privacy as afterthoughts, and forcing the public to navigate the resulting vulnerabilities on their own. When technology is deployed this aggressively, we usually expect the law to act as a safety net, especially in high-stakes fields like mental health. In Pennsylvania, regulators are currently suing a chatbot company for impersonating a therapist. It's a high-profile test of the unauthorized practice of medicine doctrine. But according to bioethicists at Harvard, Hastings, and Hebrew University, the law is currently aimed at the wrong target. This legal doctrine was written to catch humans who explicitly claim a medical title. It is blind to the chatbot that never claims to be a doctor, but still delivers therapy and medical advice every day. Because our laws are tethered to human definitions, a vast, unregulated shadow market of automated medical care is now operating outside the reach of the courts. Recognizing this gap, state lawmakers are attempting to write purpose-built AI rules to protect their citizens. Colorado recently published the first detailed rules for a state chatbot safety act. The rules would require AI companies to verify a user's age and provide clear safety disclosures. But 5 weeks before Colorado posted those rules, the Federal Trade Commission published a preemptive strike, a policy statement that could effectively paralyze state-level regulation. The FTC argues that if an AI company secretly alters its outputs to comply with a state law, that undisclosed steering constitutes a federal deception violation. They are signaling that following a state's safety rules won't defend a company against a federal claim. This creates a jurisdictional gridlock. Vendors are shipping flawed tools, and the regulators tasked with fixing them are locked in a territorial stalemate. With technology deployed and lawmakers gridlocked, who is actually left to protect the public? The burden is falling to local communities. In the Charleston County School District, the response to AI has shifted from simple bans to a campaign of radical literacy, teaching students exactly how to spot the machine's failures. Instructors use a map demo to immediately shatter the illusion of machine infallibility. They ask the AI to draw a map of the world and display the results to a live audience. The output is usually absurd. In one demo, the AI labeled Libya merely as Africa, spelled Mali as male, and rendered Egypt as Sopth. This literacy movement is scaling. Utah now mandates that every district have an AI policy by 2027, and has already trained 7,000 teachers to prove to students that an algorithm can lie just as easily as a person. The student standing at that whiteboard is the new human in the loop. They have inherited the task of manually verifying data that billion-dollar companies refuse to filter at the source. Because institutions have stalled and vendors continue shipping unpolished tools, the burden of safety has moved. Our own skepticism is the only functional safeguard left, knowing exactly when to stop trusting the machine at all.